I'm Kaveh Ardalan. I'm at Lurie Children's Hospital here in Chicago, in the Chicagoland area, and currently seeing all of the patients with juvenile myositis at our center. So our Center of Excellence was started by Dr. Lauren Pachman, who's also one of the very eminent researchers and caretakers of kids with JM in this space. And she was seeing patients until roughly 2 years ago. And so over time, her patients have transitioned to myself just over the years. In terms of how our visits go, it's sort of echoing what Dr. Ryder and Dr. Stingle have said, which is that we really want our visits to be multidisciplinary visits where you're not just getting a rheumatologist take on the situation, you're getting multiple people's input so that we can think really holistically about what's going on. So to that end, I would do the evaluation and then kind of standard rheumatology evaluation, but then we also have a physical therapist who's at every visit who does standardized strength assessments. And this is more than just checking kind of in a basic way how strong someone is. This is like pretty rigorous stuff where you have to do quite a few different sort of exercise maneuvers, which then are summed together to give scores basically about how strong kids are, similar to what is happening at GW/NIH and then at Duke. Our physical therapist, in addition to doing those strength scoring, she also does what's called hand dynamometry. So that's actually a way to measure grip strength. And there's a number of studies in dermatomyositis patients, particularly on the adult side, where they've shown that that's also an outcome that you can track in order to know how kids are progressing. She also will do evaluations of like range of motion, because a lot of times muscles get very tight and kids actually become quite stiff, lose range of motion. That's uncomfortable in and of itself, but it also can lead to abnormalities in movement, like abnormalities in walking and running that can lead to kind of chronic pain that's not necessarily due to JM itself, but due to the way JM has affected the structure of the body. And then we can recommend exercise regimens that help with dealing with that. So in addition to all of the physical therapy aspect of the visit, we also, for those families who feel comfortable with it, also offer the opportunity to participate in research studies. Dr. Pachman is still doing research, and largely that's through what's called a registry, which, as Dr. Ryder and Dr. Stingle have mentioned, that's basically where we get detailed information, some of which families might report, some of which is based on what a doctor or physical therapist sees at the visit. And then if there's a scheduled blood draw that day, same as what Dr. Stingle and Dr. Ryder have said, if families are okay with it, one more tube of blood is collected and stored so that if there are research studies about the biology of this disease or about predicting treatment response, things like that, we're able to go basically to the refrigerator and say, all right, well, here are these specimens that will help us, understand why does this disease happen and why does it play out the way it does. That's never collected with an extra poke, though. We're also very, very careful about, comfort for children. And then the other thing that's part of Dr. Pachman's research registry is doing measurements of nail fold capillary endro loops. So you might have seen in some of the presentations that some folks actually will magnify your nail beds. And it turns out if you look at them under high magnification, you can see little tiny blood vessels. This is true of all of us. Well, for kids with JM, it turns out that those blood vessels show signs of the illness. The blood vessels might be thickened. They might, instead of being nice and straight, be what we call tortuous. So that means kind of twisted. Some of them may get damaged or destroyed and go missing, so you see fewer than expected blood vessels. And some of them may have abnormal branches sprouting off them, suggesting that those blood vessels are not growing properly. Well, it turns out you can actually take pictures under magnification and look at the structure of the blood vessels, and that's a marker of how kids are doing health-wise when they have JM. And we track that on a schedule so that if we're having any questions about skin disease or things like that, we can actually ask our research coordinator, hey, can you please provide us the data from X number of visits, and you can kind of look and see if things are healing or if you're not seeing the expected healing. Those are a couple of like the overarching things that are going on. Dr. Pachman is one of the folks also with Cure JM support looking into a medicine called vamorolone, which is a new steroid that we hope might not have a lot of the side effects of traditional steroids. So that study is still in the planning stages, but we hope that one day we'll be one of the sites that can offer entry into that study. And then other than that, my own research is largely focused on patient-reported outcomes. So that's a really fancy way of saying trying to find ways to understand people's own experiences with their illness or with their child's illness and get that information and put it into a study the same way as you would a muscle test. And that way a patient or family's voice is part of the research. So for example, like what Dr. Ryder was saying, fatigue is something that is very common in kids with JM, but it turns out we actually don't have a lot of studies on this about why it's happening, who it's happening to, and how to help. Well, if you use patient-reported outcomes approaches, you can actually ask kids and parents in a really sophisticated way, tell us about your energy level. And you can get that information at each visit and then look at trends over time and eventually have treatments. So that's some of the work that I'm doing. I'll be moving to Duke later this summer myself, and that's largely driven by personal kind of changes in my family life. But the head of rheumatology at Lurie Children's, Dr. Klein Gittleman, she's actually going to be taking over for our myositis clinic, and we're actively hiring for someone more permanent to take over. But Dr. Klein was actually hired quite a while ago by Dr. Pachman personally, and so has extensive JM experience herself. So I am fully confident that she'll do an excellent job taking care of our patients and providing consultation if that's needed. All right, I think that's about it.